Whether you're pregnant or postnatal, you might be suffering with intense lower back pain. And often this is because your hip flexors and pelvic floor muscles can be tight, especially if you're someone who sits at a desk and has to work on a computer all day long, or maybe you drive for many hours a day. Those positions where we shorten the hip flexors and weaken the glutes, they can contribute to changing the position of your pelvis and creating lots of pressure in that lower lumbar spine area, which can obviously lead to aches and pains, and sometimes that pain can be debilitating. So I'm going to teach you a very quick and easy tip to help you to overcome the discomfort of tight hip flexors. So if you are pregnant, you might need a little bit of cushioning, and actually postnatally your knees might still be sensitive too. So if you take yourself down onto your knees, I like to use a little stick for balance, but you could use a gym ball to hold on to, or even just a piece of furniture. You're going to take a foot out in front of you, and you're going to follow the line of your knee towards your toe as you breathe out. So inhale to come back into your position, and exhale, tease the tightness out of the tight muscles on that movement forward. Now, I'm not a massive fan of static stretching. I think that leads to too many complications during pregnancy and post-birth. But if you keep your stretches and releases dynamic, what's going to happen is you're going to tease the tightness of the muscles out safely, rather than holding and being prone to tearing perhaps a ligament or a little tendon. Now, this is also a very handy technique if your baby is struggling to descend into your pelvis during labour. These kind of releases can make space in the pelvic floor for the baby to descend and rotate into the perfect position for being born. And in order to facilitate that, you could take your lunge slightly sideways. Now, if you have pubic bone pain, this might not feel very pleasant, but for the purpose of helping your baby to exit the pelvis, this can be helpful, and we can always deal with any rehabilitation after you've had your baby. But to go back to tight hip flexors for aches and pains, let's change feet and follow the line of the knee over the toe. Now, one of the things that you can do here to just accelerate the release is, as you come forward here, squeeze your bottom muscles on the back leg and see if that helps you to tilt your pelvis and just open up that tightness a little bit more. So this is my tight side. I can definitely feel that this definitely needs a little bit of work. And again, just for balance, you can go into the adductor release here. And so that's your inner thigh muscles. Inner thighs, hip flexors, they're all connected to your pelvic floor. And if you have seen my video on easing lower backache with prickly balls, then that is a perfect combination to do with this little tip. Hope it helps. Any questions or comments? Chat to me below.